Well, welcome back to the program. Thank you very much for joining us. So coming up just shortly after 8 o'clock, my colleague in the United States, our correspondent there, Sharon Bryce Peace, will be in conversation with South Africa's former president, Thabo Mbeki. And in a wide-ranging interview, of course, you would know that there have been wide-scale responses to what happened to George Floyd in the United States, the killing of George Floyd at the hands of police in that country. And the former president will weigh in on that. You would know, of course, that there are a number of countries that have also gone out in solidarity against what had happened to George Floyd. He was, of course, buried in Houston, Texas yesterday. We saw quite a huge number of people come out there and share their condolences, but are saying that the protests that have taken place there, that those should not just end there. There should be more that should be done in order to ensure that justice is obtained for George Floyd. So that SABC interview with the former South African President Thabo Mbeki coming up shortly after 8 o'clock with my colleague Sharon Bryce Peace. All right, so the number of people who've died from the coronavirus in South Africa stands at 1,162. This after another 82 people passed on. 2,112 new infections were also recorded, taking the total number of cases to almost 53,000. Recoveries have also risen by 2,907 to 29,006. Experts maintain that a change in behaviour is the only way to halt the speed at which the virus is spreading. There have also been warnings that the big wave is still approaching. Shabir Mahdi is a professor of vaccinology at Wits University and joins me now via Skype. Prof, a very good evening to you. Thanks indeed for your time.
A good evening to you.
Prof, what looks to be, a ticking time bomb in the surge in cases in the Eastern Cape also fears that that province could be where the Western Cape is in a matter of weeks. That's of great concern at the moment. What do you think should be done to avoid this?
Yeah, so I think what you're saying is correct and unfortunately true. And as you said in the introduction, the only thing that is going to assist South Africa in terms of controlling the rate of transmission of the virus, which is really what we aspire towards, is the behavior of the citizens. And we've repeatedly asked people to adhere to the non-pharmaceutical interventions, such as hand hygiene, the wearing of non-surgical face masks, irrespective of whether someone feels ill or not, as well as things such as physical distancing and avoiding overcrowded situations. Those are the only tools that we've got available to us to assist us in terms of slowing the rate of transmission of this virus. Going back to a level 5 lockdown essentially is not a strategy to try to contain the rate of transmission of the virus. Even when South Africa was in a level 5 lockdown for 5 weeks, we still had ongoing community transmission, because the reality in South Africa is that many individuals, many communities, unfortunately are simply not able to exercise a level 5 type of a lockdown because they don't have the luxury of being able to, as an example, stockpile in terms of food or other necessities. So going back to a level 5 is certainly not a solution. The only thing that we've got available to us are those non-pharmaceutical interventions, which the populace really needs to buy into.
Well, you speak about, a change in behaviour is what will save the situation. But I mean, if you look at an instance like in the Eastern Cape, the condition of the healthcare system in that province and what reports suggest is an increasing number of healthcare professionals being infected. Surely a lot more focus should be placed on these challenges and solutions found.
Correct. So one of the biggest challenges that we face in our healthcare facilities right now is that the amount of testing that's done is reasonable, but the turnaround time in terms of which those results get back to the healthcare workers, unfortunately, is not adequate. And that is basically lending itself to healthcare workers inadvertently being exposed to individuals that are infected, that they don't know, that are infected simply because they're not getting the results soon enough. So what really needs to be done immediately is that the testing of individuals that are being hospitalized needs to be prioritized, as well as the testing of those healthcare workers that are actually symptomatic, because they might well have been infected in the workplace. So we really need to become much more stringent in terms of who we're testing and ensure that we get results back within 12 to 24 hours, both to assist in terms of the management of the patients, as well as in terms of assisting healthcare workers to avoid them becoming infected by the virus.
And that's quite a critical issue, Prof, because with over 968,000 tests done so far, I understand there's also a backlog in testing. How is this likely to affect the true picture of the number of infections?
Right. So I think it's important that we shouldn't get obsessed with the number of tests that we've done. What's really important at this stage is how quickly we can actually get those results back to the individuals that are being tested. And as I mentioned, it really assists us in terms of management of the individuals. So as you correctly pointed out, with there being close on to 80,000 or 90,000 backlog in terms of the number of tests, it's difficult to quantify as to exactly what the true number of cases are in South Africa. And even if there wasn't a backlog of tests, it would still be difficult to quantify the true number of cases in South Africa, because the reality is that even though South Africa is doing much more tests than any other country on the African continent, it is only doing roughly about 1/10 of the number of tests per thousand of the population compared to European countries. So we've got huge challenges in terms of our testing capacity, not all of which is due to our fault or due to the faults of laboratories or government. It's simply because there are a number of external factors that are limiting our ability to scale up testing at the rate that we should be doing. And that's another reason why we're saying that it's critical at this point in time for us to understand our constraints, to accept it, and to prioritize that resources that is available to us to ensure that we get a maximum benefit in terms of who we test and how quickly we can get those results back.
Yeah, Prof, before I let you go, one of those constraints seemingly, if you talk about change behavior being critical to slowing down the spread of this virus, risk communication would also be key. Do you think there's been sufficient risk communication in critical areas, for example?
Yeah, unfortunately not. And I think the knowledge about this virus in the general community is something which is really lacking. And that's one of the factors that's influencing the behavior of people, at least influencing them not adhering to the type of non-pharmaceutical interventions. So perhaps the most important thing that needs to be done over the next week or so, in fact, and we don't have the luxury of time, it really needs to be done urgently, is a knowledge about this virus to the general populace has to increase exponentially. We need to make use of every opportunity to get people to understand that COVID-19 is something that is very real. It is killing people in South Africa, and it's going to get worse over the next few weeks. And unless people start adhering to physical distancing, unlike what you're showing on the screen right now, unless people start adhering to physical distancing, the wearing of non-surgical face masks, hand hygiene, we are going to be in for a torrid time. So it's really critical that South Africans understand what is required to us reduce total continuing.
Prof, I'm afraid we lost you a bit there towards the end, but got a gist of what you were saying. Thank you very much indeed for your time. Shabir Mahdi is a professor of Vaccinology at Wits University. Thank you very much for that, saying that changed behaviour is going to be critical to ensuring, that South Africa does not reach this wave much faster. Concerns about the Eastern Cape numbers heading towards the figures that we're seeing in the Western Cape. And, some of the critical communication that needs to be done in areas where people don't seem to get exactly how dangerous it is not to adhere to some of those protocols, such as social distancing or physical distancing, as well as wearing your mask. Let's go.